Good morning. My name is Harold Scoggins, Fire Chief of the Seattle Fire Department. I want to lead with a thank you to Mayor Harold and Councilmember Herbold for your ongoing support of the Seattle Fire Department. You know, it's really important to note that this isn't just the fire department, it's Seattle Fire Department, Human Services Department, and so many other community partnerships. We're living Mayor Harold's One Seattle vision in the work that we do every single day. Our pilot began on July 7th of this year. We have continued to see a steady increase of Seattle firefighter EMTs, paramedics, responding to suspected overdoses in the city. Current Seattle fire overdose data reads like this. We're going on about 15 a day, a little bit over 15 overdoses a day. Now, to put that in perspective, so far this year, we have responded to over 4,000 overdoses of all kinds. And once again, to ground you a little bit more, all of 22, we responded to just over 3,700. So we're in September, mid-September, we're over 4,000. And we've already exceeded 2022's number significantly. In 2021, we had about 1,700. So the problem is getting bigger, and it's important to deploy resources to help with that. Frontline Seattle firefighter EMTs or paramedics are dispatched initially to overdoses to provide emergency medical care. And the new post-overdose response team is added to these responses as available. The role of the post-overdose response team begins once the patient is awake. It's important to note. So the firefighter, EMTs, and medics have got there, they've done their thing, they've stabilized the patient, and now Health 99 is on the scene. The post-overdose response team is part of the fire department's mobile integrated health program and responds out as Health 99. And just to give you a little bit about our mobile integrated health team, you know, we all know we launched that program in 2019 with Health One. We have a vulnerable adult program. Our case managers do an amazing job responding to vulnerable adults. So this is another component of that team. But Health 99 is staffed with the firefighter EMT and a human services department case manager. And Riley is here today. Riley goes on most of these responses. The single unit typically operates Monday through Thursday from 9 a.m. to 7 p.m. Health 99 works with a wide array of service providers to connect individuals who have experienced an overdose with outpatient substance use services, primary care, homeless outreach services, and so much more. The pilot program focuses on Pioneer Square, Chinatown International District, Belltown, the Downtown Business District, and Capitol Hill. But the team has discretion to respond elsewhere in the city. Health 99 stats since becoming operational, they've responded to 68 overdoses. They've conducted 20 client outreach visits. That's after the overdose, during follow-up with the person who has had an overdose. From combined overdose responses and follow-up visits, the unit has provided services to a total of 52 individuals. Some of the clients served by Health 99 have been seen numerous times by the unit. That means the same person is overdosing over and over again, and the team is on scene, still doing the work, still trying to get them in the services. 77% of those served by Health 99 are male. The majority are also experiencing homelessness and have a mental health history, in addition to battling the addiction. The team averages 3 to 5 overdose responses per 10-hour shift. And as you can imagine, when they find someone that says yes, and they actually start getting them in the services, that is a very long response where they're providing the care and needed services to get them connected that you're going to hear a little bit later. With the success we have had thus far in the pilot, there are so many difficulties and barriers to this work. A sizable percentage of clients served by Health 99 can't and won't engage in services, but that doesn't mean we stop. Our team stays on it. Experiencing overdose or have a need to go to the hospital. Many of them are using meth at the same time, which makes this work much harder. So it could be fentanyl, it could be meth, it could be opioids, a combination thereof, and it makes the work much more complicated. There are also challenges with finding clients after the first contact, since so many are unhoused. And this is where our Health One program comes into play. They help with that. We work really hard to find the person after the overdose. Additionally, finding destinations for all hours, clinics, places to do buprenorphine induction, and shelters also prevents difficulties. So finding a place to take a person to get the needed care can be a challenge sometimes. Success for this unit so far includes connecting clients with resources, but it also encompasses harm reduction or even having a conversation with individuals after the overdose. And sometimes that means Health 99 is doing a leave behind with Narcan or naloxone, just as our Health One units are doing also. So if they haven't said yes, let us give you this in case it happens again. Since this is a pilot, much of our work to date has revolved around establishing partnerships and learning about characteristics of overdose and overdose reversals. It's important that we understand what that is. Because we have personnel who are on the front lines, we think the fire department is well equipped to be a part of the multi-system response to this drug epidemic we are facing. Next, I'd like to introduce Seattle Fire's Mobile Integrated Health Program, John Ehrenfeld, who does much of the critical thinking with his team on how we respond to overdoses. And it's important to note that members of his team came up with the idea and concept of actually putting Health 99 on the street. So now I'll turn it over to John.